Have you ever sat in a doctor's appointment nodding along while silently wondering what half the words actually meant? You're not alone, and today we're going to take the mystery out of medical speak so you can walk into appointments feeling informed, confident, and in control. Welcome to Radiant Moments, a J&B podcast. I'm Michelle, and I'm so glad you've carved out this time for yourself today. Let's begin by pressing pause on everything else. No to-do lists, no demands, just you. Take a deep breath in, hold it, and gently exhale. This moment is yours. You've shown up, and that's powerful. In our last episode, we talked about navigating healthcare systems with confidence, understanding your role as an advocate, and how to build trust with your care team. If you haven't listened yet, I encourage you to go back. It's a perfect foundation for what we're diving into today. Because here's the thing. Even the best medical team can't fully support your loved one if you feel shut out of the conversation. And that's what happens when medical language becomes a barrier instead of a bridge. So today's episode is all about breaking down those barriers. Medical terminology can be intimidating, especially when you're overwhelmed, tired, or trying to process a lot of information at once. You hear acronyms like FBC or MRI and feel like you should know what they mean, but you don't want to interrupt to ask. Doctors mention condition, test results, or treatment plans, but the words feel more like code than communication. You leave appointments thinking, wait, what exactly just happened then? Here's the truth. Medical language isn't designed to confuse you, but it often does. And when communication breaks down, your confidence takes a hit, and your ability to advocate effectively is compromised. However, the good news, you don't need to be fluent in medical jargon to feel empowered. You just need a few simple tools, and that's exactly what we're going to explore today. Your first affirmation in today's episode is, I have the right to understand the care my loved one receives, and I am capable of asking for clarity. The power of simple questions. Sometimes the most powerful tool you have is the courage to ask a simple question. Try asking, can you explain that in everyday terms? What does that acronym stand for? Can you walk me through what this test result actually means? You might feel hesitant at first, but medical professionals want you to understand. You are a vital part of your loved one's care team. One of our caregiving listeners shared that during one of her child's hospital stays, the doctor kept saying GI motility issues. She nodded along for weeks until one day she finally asked, can you tell me what that actually means in plain language? The answer? Her child's digestive system wasn't moving food the way it should. That moment changed everything because once she understood the problem, she was empowered and equipped to ask the right questions, seek second opinions, and better manage the symptoms. And that's the thing. Medical language isn't just technical. It can be emotionally overwhelming. When you're already carrying the weight of caregiving, unclear or unexplained terminology can add a whole new layer of stress, fear, or even panic. This isn't just something I've seen, it's something I've lived. Let me share a few real experiences that highlight just how critical clear communication really is. Throughout my journey as a medical carer, I've encountered countless moments where medical language, whether in letters, conversation, or during hospital stays, caused not just confusion, but chaos, distress, and unnecessary concern. Not because the information was wrong, but because no one took the time to explain it, and they assumed that I knew it. Recently, I received a letter stating that I had been referred to the hepatology department. I had never even heard of hepatology, so naturally I researched it and found that it dealt with liver failure, gallbladder issues, and bile ducts. Panic set in. Was there something wrong that no one had told me? Why was I being referred to this department? There was no explanation, no contact name, and no context. I didn't even know which medical professional had done the referral. After a lot of digging, I discovered that this department also handles complex abdominal wall issues from previous surgeries, something that did apply to me. but the amount of effort it took to simply understand the referrer was outrageous. That moment reminded me, in the medical world, transparency isn't always a given. It's easy for professionals to forget that we haven't walked the same educational path that they have. And it's not just about me. I remember receiving a hospital letter about my child, after a pediatric review. It said he had voluntary anorexia. My heart dropped. I immediately thought of the eating disorder. No explanation followed. That letter caused unnecessary stress, difficult conversation with others, and emotional turmoil. It wasn't until much later, after another appointment, that someone explained that anorexia, in medical terms, simply means a temporary period of not eating. In our case, it was due to bleeding from the bowels during a food trial. They had to go nil by mouth. What the letter should have said was that it was not anorexia nervosa, the eating disorder, but it didn't. At the very beginning of my caregiving journey, when my son was just a baby and needed his first surgery, the team mentioned Hirschsprung's disease, but no one explained what it was. I was left completely in the dark, too afraid to ask questions, unsure of what any of it really meant. I later realized I could ask questions, and I sat down with a list for the doctor, determined to understand what was being suspected and how it might impact my son's life. These are just a few of the many times I've learned the hard way that medical professionals often forget we're not on the same page as them. They use this language daily. It's second nature to them. But for caregivers, that terminology can change how we feel, how we act, and how we understand our loved one's condition. So here's the truth. You can't wait for them to explain things. As caregivers, we have to ask. We have to advocate. We have to hold them accountable for how they communicate with us as part of the team. Because we deserve to be in the loop, not left to piece things together on our own. These moments were powerful reminders for me that as a caregiver, we have to become our own interpreters, because medical professionals don't always realize what they're leaving unsaid. That's why this next segment, I want to give you a simple, supportive tool you can keep with you. It's not about knowing everything. It's about having a little more clarity when you need it most. Let's walk through your very own medical vocabulary cheat sheet. One of the most overwhelming parts of caregiving is trying to understand what's being said in medical settings. Doctors, nurses, specialists, allied health, they speak in a language that can feel like a code. And here's the truth, you don't have to know it all, but having a solid grasp of the basics can boost your confidence, help you advocate better, and reduce unnecessary stress. Now, everyone's medical journey is unique, but these are just the basics. So let's break down some of the most common terms into easy to understand categories. Let's look at diagnostic tools and procedures. These are tests that help doctors diagnose conditions or monitor ongoing treatment. An MRI is a magnetic resonance imaging. It uses magnets and radio waves to create digital images of organs and soft tissues. A CT scan is a computed tomography. Combines X-rays with computer technology to produce cross-sectional images of the body. An ultrasound sends sound waves that produce images of internal organs, often used for monitoring soft tissue or blood flow. An X-ray is a quick image of bones or dense areas inside the body. FBC, which is your full blood count, or CBC, which is a complete blood count. It's a common blood test that checks levels of red and white blood cells, hemoglobin, and platelets. An ECG or an EKG is electrocardiogram, a test that measures heart activity through electrical signals. Basic terms you'll hear often. These come up in nearly every setting, from GP visits to hospital rounds. Acute, a sudden or short-term condition. Acute pain or an infection. Chronic is a long-term ongoing condition, like a chronic illness or symptoms. Benign is a non-cancerous or not harmful mass, whereas a malignant is cancerous or potentially dangerous mass. Inflammation, the body's response to irritation or infection, may show up as redness, swelling, heat, or pain. Edema is swelling caused by fluid buildup. Prognosis, the expected outcome of a condition. Symptom versus sign. A symptom is what the patient feels, like pain. A sign is what can be observed or measured, a fever, heart rate. Medication and treatment terms. Understanding what's on prescriptions and treatment plans. So you may be asked, do you want generic versus brand name? Same medication, different manufacturer and label. PRN, pro renata, as needed medication, which is not scheduled. Titration, slowly adjusting medication dosages to find the right balance. Contraindication, a reason why a treatment or drug shouldn't be used. Side effect versus adverse reaction. Side effects are expected but manageable. Adverse reactions are more severe and may require stopping the treatment altogether. Polypharmacy, taking multiple medications which can raise the risk of interactions. I want you to try this and build your own cheat sheet based on your medical journey and your loved one's needs. Create a caregiver glossary. You keep it in your binder, notes app, or journal. Every time a new term comes up, jot it down. Then, ask for clarification in the moment. Can you explain that in everyday language? Look it up and research later with reputable sources like Mayo Clinic or Healthline. Add notes based on your loved one's needs. Make it personal and practical. Affirmation 2 for today. I am capable of learning and growing. Every question I ask brings me closer to confidence and clarity. Here are a few ways to feel more prepared. 1. Bring a notebook or use your phone to jot down terms during appointments. Number 2, ask the care team to write important details or spell out difficult words. Number 3, repeat back what you've heard to confirm your understanding. So what I'm hearing is, we've adjusted the dose because his inflammation is increasing. Is that right? Here's a pro tip. You can always say, can I have a written summary of today's visit? Some practices offer this, especially through patient portals. Real empowerment comes from understanding, and understanding begins with giving yourself permission to ask. This week, your challenge is simple. Write down 3 medical terms you've heard recently but didn't fully understand. I want you to then look them up in a caregiver-friendly guide, or ask your care team directly. If you're really nervous about asking, you can practice saying, can you explain that in plain language, please? Or can you provide it in writing? Keep a running list of future references. It's your personal glossary of power. And I'd love to hear from you. What's one medical term that used to confuse you, but you now understand? Share it in the comments or DM me so we can keep learning together. If you need further support, don't hesitate to download one of our free caregiver resources, which are linked in the show notes below. Check out the JMB Oasis membership and subscribe to our waitlist. And don't forget, you can always reach out to our community when things feel unclear. Thank you for joining me on Radiant Moments, a JMB podcast. Today we took one more step towards confidence and clarity, because knowledge is power, especially in caregiving. Next time we're talking about preparing for doctor's appointments, maximizing your time. I'll share practical strategies to help you walk into every appointment feeling focused, prepared, and heard. Until then, stay radiant, stay empowered, and keep shining your light bright.